Good morning, everybody. It's a beautiful sunny day out here in Pennsylvania where I live by the river. It's just really fantastic. You couldn't even tell that there's this horrible crisis going on globally, but we still have it. And let me present some interesting statistics for today. This, of course, is our growth and prevalence in the United States. So I started this on March 12th, and it's April 19th, so you can see how things have changed over that period. This is the prevalence per 100,000 individuals. And again, this is a comparison between Spain, Italy in green, the United States, and South Korea. South Korea, you have this massive dip going on here that just, well, I shouldn't say massive, it's this massive gap between them and the rest of the countries that I'm looking at. So they're doing a great job there. So my figure looking at case fatality related to hospitals per 100,000 and population density and proportion of the population 65 and above. I added some more countries today, so I'm at like 44 different countries now. So this is getting more and more clear as we add more countries to this. So this is the case fatality, keeps on going down. Case fatality is it's the number of deaths from coronavirus divided by the number of cases of coronavirus. So this is like, it tells you basically the probability of dying if you get this. You can see it's highly related to age, population above 65, but where there aren't an equivalent or a matching number of hospital beds. This is in blue, hospital beds per 1,000 individuals, where there's this biggest gap between older population and hospital beds. You see the highest level of case fatalities. And then this is the population density here. So that's telling. This is my HB65 index, where I divide the number of hospital beds per 1,000 in each country by the proportion of the population 65 and above. So this is that index, and here's a trend line for that, and then this is the case fatality. So you can see that there's this inverse relation here. So in terms of today's numbers, the highest case fatality is in Belgium with about 15%, followed by UK, Italy, France, Netherlands, Sweden, and Spain. Those are all above 10. Those are my red zones. And these are the prevalences in those areas. And then the countries that I consider in yellow, including the United States, although I highlighted it in gray here, are from 2 to 6, basically 2 to 7% case fatality. We're at 5.3%. A lot of that's driven, of course, by New York City and New York and Michigan that have high case fatalities and high prevalences. So it's like I added Peru in here. It has a case fatality of 2%. See, I added Finland. It's like 2.4%. Norway is an interesting case because it has a decent number of individuals infected per 100,000, but the case fatality is quite low, so they're doing something right over there. And then in the green, these are countries that have very low case fatalities, like South Africa. Let's see, I added a lot of wealthier countries in here too, because I was curious about how well they're doing, like Kuwait. I removed Monaco, which I had earlier, because it's just first of all, it's a very small country, very, very dense, but a very small population, so it made it for difficult to compare it to these other countries. It should be compared to a city rather than a country, but I can look at that at some other time. So the average prevalence per 100,000 is 82, but because it's skewed by certain countries, like say Luxembourg, that has 457 cases per 100,000, median is better to use. This is the value in the middle. It's about 42 per 100,000, and then in terms of case fatality, we're somewhere between 3 and 4, depending if you like the median or the mean. I'd still use the median, but 3% chance of dying, 3.5%. So I ran analyses to see if what I'm thinking is correct. So I used the World Bank data and a variety of other sources to gather hospitals per 1,000, population density, proportion of the population 65 or above, and then I also added an interaction. So an interaction test for moderation. So moderation is like when different levels of a variable influence the effect of some predictor on an outcome. So in this case, does population density influence the relation between, and this is a density by proportion of the population 65 or above. So does it influence the effect of a population 65 or above on case fatality? Case fatality is natural log transform to remove some issues we had with homogeneity of variance across the different levels of the predictors. And so we see just by itself as a main effect, proportion of population 65 and above has a significant effect on case fatality. So that means more individuals you have 65 and above, the higher the case fatality. And here we have, also the number of hospitals per 1,000 is also inversely related to, so there's a negative, you see a negative sign here. It's inversely related to the case fatality. So the greater the number of hospitals per 1,000, the lower the case fatality. And we also note that these are significant with p-values, probability of rejecting, probability of the observed result given the null hypothesis is true is like low here, it's all below 0.0001 here, and the interaction is also significant. And so I'm using this Hayes macro, which allows you to do a lot of this stuff pretty easily. And this model accounts for, by the way, about 38% of the variance with the R-square. This doesn't produce an adjusted R-square, so that's just the proportion of the variance accounted for. And in terms of, if we look at our interaction term, so this also plots the interaction for us. So we're looking at different levels of density. These are in percentiles. I believe it's 16th percentile. That means in terms of population density, a country at the 16th percentile will have a population density greater than or equal to 16% of the population. Then we have at the mean, which is the 50th percentile, and then the 84th. So it's the 16th, 50th, and the 84th percentile. And then, so we see at this higher level of density here, we have a strong relation between the proportion of the population 65 and above and the case fatality. And you can see that here. This actually shows that. This breaks it down for you. So essentially this is saying as our density increases, the relation between population 65 and above and case fatality gets stronger. I also did my analysis using this HB65 index, and so we saw that in the blue figure a little while ago here. We saw this really nice looking inverse relation between the two, right? So if we go down to the analysis that I did, and here I just controlled for population density, and this is just a standard, as a garden variety regression analysis. You have a real clear, strong inverse relation, which is significant between this HB65 index and case fatality. So what's the bottom line then? The bottom line is for policy and public health, we need more to be concerned about our healthcare system and how it relates to individuals, the proportion of our population that is 65 and above. So we kind of have to do a better job taking care of our elderly. That's it, and I hope you have a nice day and stay safe. Bye.